If insight alone healed trauma, most of the people watching this video would already be better. You can understand your trauma, you can name it, you can talk about it intellectually, and still find yourself reacting in ways that don't make sense. This is especially frustrating for high-functioning, thoughtful people. People who have done therapy, people who've read the books, people who know where their patterns come from. They often ask me, why do I still react this way if I understand it? The answer is simple and relieving. You can't think your way out of trauma because trauma doesn't live in the thinking part of the brain. Trauma lives in the nervous system. And insight alone isn't enough. Insight that's purely intellectual, that is. Why is this the case? Well, for one, trauma is stored implicitly, not logically. Trauma is encoded through sensation, emotion, and our survival responses. That's why your body can feel unsafe even when your mind knows that you're okay. Your nervous system does not operate on logic. It operates on pattern. Patterns formed long ago, even likely before you developed the ability to language and verbalize your experience. Secondly, the nervous system is always scanning for safety. Your nervous system is constantly asking the question, am I safe right now? Insight doesn't answer that question, not intellectually based insight. Safety is actually communicated through tone, presence, pacing, and regulation. Thirdly, revisiting trauma without regulation can keep you stuck. When painful material is revisited without grounding or safety, the nervous system learns this is still dangerous. That's why people can feel like they're doing the work, but still not moving forward. So what actually heals trauma? Healing happens when the body experiences safety while old patterns are activated. This is why trauma-informed approaches work. Approaches like EMDR, or eye movement desensitization and reprocessing therapy, somatic-based therapy, and parts-based reparenting don't just talk about trauma. They actually give your nervous system the experience, which helps your nervous system start to experience these painful things differently over time and repetition, little by little. So reparenting fits into all this. How? Well, reparenting is about becoming that source of safety that your nervous system needed but didn't consistently receive. It's absolutely not about fixing yourself. It's about meeting younger parts of you with an emotional presence that they never received, that they needed and still need, with protection and with compassion. When safety comes online, patterns will naturally start to soften slowly and steadily. If insight hasn't been enough for you, that doesn't mean you're failing. It just means your nervous system needs a different language. If you want structured trauma-informed support for this work, you can explore my Reparenting course linked below. You're not broken. You're becoming regulated.